Alrighty, I got some bad news, fam. Is bad. It's it's mortally bad. I, like probably most of you and most everybody you know, have not been taking this coronavirus thing seriously because uh, we as humans have this like fool me once, shame on you, fool me twice, shame on me thing, right? Right? So uh, we were all probably fooled at some point by a hyperbole around the SARS virus, the bird flu, the Ebola, mad cow disease, pick one. Seems like every year there's some scare about the next pandemic. And I've looked into these things before, so I have a fair amount of background knowledge about uh, how to respond to potential pandemics. And I had a lot of confidence that even if this was as serious as they were saying, I had confidence in our modern infrastructure and medical kind of knowledge to deal with it. And, I saw that China was doing a good job of containing it and quarantining. And I was like, whatever. It kills a little higher than the flu, but no big deal. And I'm very disturbed to report that I was tremendously underestimating it. I never really looked into it. Today I got curious. I was wondering, like, okay, well, what are the symptoms of coronavirus? It seems to be trending again, hurt the stock market. Let me look into it a little bit. And one thing led to another, and this is different than all the other ones. This shit is real. So I'm going to try to explain this in a simple way for you to understand, and what we can do about it and what we need to do about it. So to start with, the difference between a human disease and a plague. It's really the best way to introduce this, I think, is the way C.G.P. Gray did. And that's with a question I'd never thought of before. The question is, why did Europeans bring diseases to Native Americans that wiped out 90% of their population, but the Native Americans didn't bring diseases to Europe that wiped out them? Right? Like, we actually brought Native Americans to Europe as slaves, and there was no plagues brought from them. Why wasn't there crossover? Well, the answer is the Americas were, in a way, evolutionarily lucky, and in a way, evolutionarily unlucky, that they didn't have animals that were easy to domesticate. The only domesticated animal in the Americas is the llamas and alpacas, and they're obnoxious creatures that don't cohabit with humans. They're kept out in pastures, so they're not living with people. Whereas in Europe, we domesticated a whole bunch of animals: pigs, cows, chickens, and dogs and cats and more, and we lived with them. And because of that, you had these cities in the medieval world where they were just plague factories. People walking around in animal filth, and the thing is that matters because a disease that's evolved to affect humans doesn't kill humans very much unless you have a really low immune system. And that's because bacteria and viruses don't want to kill you. They want you to stay alive so that you'll keep spreading their disease to everybody else. That's evolutionarily just what they want to do. Not that they're conscious about it, obviously. Well, that's human diseases. Diseases that were evolved for other species that then jump to humans can have a much higher fatality rate because they didn't evolve for humans. So, fortunately, it's very, very rare for diseases to make the jump from between species because they're very particularly adapted to one species. So it's very, very, very rare. It's like a Powerball lottery, or worse. But when you had the whole population of Europe cohabiting with animals, it was bound to happen more often. So they had plagues, and people had to immigrate to cities often to live, And so there's this constant immigration into cities, so that in many cities, such as London, their population would have been declining if not for immigration, because plagues were killing them at such a fast rate. So that brings us to now, because we've had multiple different plagues that have made the jump from animals to humans in recent history, and we've been pretty good about how we dealt with them. We contained and ultimately destroyed the SARS epidemic and others, so that they've pretty much disappeared. Like, they don't exist anymore. They're not a problem we have to worry about. That's because most plagues, again, are much more fatal and much more serious, which means they kill at a higher rate, which means they don't spread so much. So they're easier to quarantine. With our better medical apparatus and infrastructure and communication technology, we can quickly shut them down and quarantine them. You find out somebody's sick within a day or two, and then you find out everybody they came into contact with in the near future, and you quarantine all of them too, and then you quarantine the whole area. You have like concentric circles of quarantine, and that's how you stop these plagues from spreading. Like, we know how to do it. So this is why I wasn't initially concerned about the coronavirus. But the coronavirus is a very rare type of plague. And the reason it's so dangerous is because it has a far lower fatality rate than most plagues do. So it did make the jump from animals, and it does kill at a higher rate. It has about a 2% fatality rate. But since it's not that serious, there's been cases of people who were spreading the disease for 2 weeks without anyone noticing, because they didn't feel that bad. For many healthy people, you just feel a little bit under the weather if you have any symptoms at all. And that's what makes it extremely difficult to stop. Because if you don't know you're sick, and thus you're not getting tested, how are you supposed to quarantine people? People are traveling all over the place. It's a global community. People go on vacations, on business trips, and they don't know they're sick, and they're spreading it. So this is catastrophically bad, because many experts now think that we cannot contain it. It's just going to become another seasonal virus. I need to get some gas here. I'm going to see if I can... Okay. We're all gassed up. I'll splice these two together. First time I've had to do that, my road rants. Where were we? So yes, many experts now think we won't be able to stop this. The Atlantic article I'll link in the description. It speaks to one of these experts, and you'll notice, based on what he said and my other background information, the only way this could be stopped is if all the societies of the world, and like every country that currently has COVID-19 cases, cared more about human lives than profit. So yeah, we're fucked, basically. Because we all know most countries care more about profit than human lives. Certainly the United States under Trump administration. Because the only way to stop it, like the article talks about how none of the big pharmaceutical research and development labs are even working on a vaccine yet. This is a tremendous global threat to humanity. All right, we're talking about a flu. Most people catch the flu every season. And you're talking about one that kills at 20 times the rate. You have any idea what the cost in human lives is for that every year, if that becomes endemic to the population? Yeah, it's a big fucking deal. Governments should be nationalizing and seizing big pharma research and development labs and repurposing them to work on vaccines. Like, waiting for them, a big pharma company to see the the profit potential here and jump on board is insanity. Waiting for the smaller labs to come up with something is insanity. Waiting for charity groups to come up with something is insanity. This is something a profit model economy and charity-driven country can't address. And here's the worst thing. Let me back up. So, again, I've looked up the numbers. The average flu, the usual flu, kills about 0.1% of it has about a 0.1% fatality rate. So that's what one per 1,000 dies. So that means every year the flu kills about, it said 12,000 to 60,000. So it depends on how bad the flu year is, basically. Well, 20 times 50,000 is 1 million people in the United States every year. The average person knows about 300 or 400 people. There's 330 million people in the United States. That means, and that's with flu vaccines, by the way. That's with flu vaccines in the United States. That means one person you know dies to COVID-19 every year. Do you see why this isn't hyperbole anymore? Like, this is fucking serious. This needs to be treated seriously. We should be nationalizing labs. We should be taking every single case seriously and shutting, like literally, if one person tests positive for coronavirus, you need a fucking team of investigators finding out everybody they came into contact with, quarantining those people, and doing a broader quarantine on the whole region, not allowing any travel, and like not allowing people to congregate, and like another layer over that with lower restrictions. So there's like extreme quarantine, and then and then like different levels of quarantine as you kind of filter out. I don't like the fact that I'm coughing while I'm talking about a respiratory illness that's spreading all over the world. Like, I'm getting a little cough in here. This could be like psychosomatic illness. I don't know. Anyway. So yes, very bad. Today, the Trump administration said that it cannot guarantee COVID-19 vaccines will be affordable because we want to make sure the big pharma companies have a profit motive to develop them and like save us all. So that means under a Trump administration, like if he wins re-election in 4 years, he's going to have 4 years of this. We are going to live in a dystopia starting next year because the expert in the article quoted thinks that 40 to 70% of the U.S. population could have COVID by the end of the year. By like next year, we could be living in a world, and this is the thing. It's not like smallpox or something where you have it once and then you're done. It's not like you catch it 1 year, you live, you're like, whew, I'm not going to be one of the 2% that dies, and then you're good for life. No, this is a coronavirus. It mutates very quickly, just like the flu virus does. So most likely, and there still needs to be research on this, and hopefully we're all wrong, but most likely it will mutate at a rate such that you need an annual vaccine or you'll catch it again. So that means under a Trump administration, we're going to live in a world where for-profit big pharma companies will be able to sell the COVID-19 vaccine in a supply and demand economy where the demand is fucking high because if you don't get it, you have a 1 in 300 chance of dying. They're already known to price gouge. They already charge like up to $1 million for some drugs. Like we all know, there's no drugs that are all that expensive to manufacture. Once we know how to make them, we're really good at manufacturing shit with the technology we have. We're really fucking good at it. So no matter how difficult it is to make, we can come up with a mass manufacturing process that makes it at a very inexpensive rate. But that has nothing to do with how much they sell for in a market economy. Do you want to live in a world where you have to either pay whatever a pharmaceutical company wants you to pay for a most likely patented vaccine, or run a 1 in 300 chance of personally dying, and like a 1 in freaking 10 or 20 chance of spreading the illness to somebody else in your family and watching them die? Every year it's like, can I afford that? Can I afford that vaccine? I sure hope everyone I know can afford that vaccine, or we're fucked. I don't want to fucking live in that world. Do you? So no, it's like, I've already said it was the most important election in history. But yes, Bernie countered the Trump administration's reports that they're not going to guarantee that it's affordable by saying the obvious is Medicare for All says healthcare is a human right, and that he will guarantee that it's not just affordable, that everybody has it. You don't have to pay out of pocket. It's free at the point of fucking service. That's the world I want to live in. That's the world we need to make sure we all live in. The thing that disturbs me even more is the potential for Trump to weaponize fears of the coronavirus in November to keep people from going to the polls and suppress voter turnout, which will help him. So it's just a train wreck of bad news, fam. I'm sorry, but it makes it all that much more important to get out there and fight for Bernie Sanders. We need to be out there canvassing. And, as I was saying in my tweets today, and follow me on Twitter, Re-Vera Life, we shouldn't just canvass because we should. We shouldn't just phone bank because we should. Do it because it fucking feels good. It really does, fam. Like, if you ever feel a little down or a little depressed, go to BernieSanders.com. You can be phone banking within minutes. They make it really easy for you. Or go out and canvass, knock some doors. Like, sign up for some Bernie Sanders events. I guarantee you that there's some near you. They're all over the place. If there isn't, start one. It feels good. It is such a positive experience. They have apps and lists of names that are like left-leaning independents or Democrats. So it's not like you're talking to Trump supporters. These are good people. You have good conversations. You get to flip a few people to Bernie, and it just makes you feel so fucking good that you're making a positive impact in the world. If you actually, not so much phone banking, but if you go out canvassing for these events, you're going to meet other Bernie people that are doing the same thing. And these are such good people. Bernie people are good people, fam. Like, you're going to have a blast. You're going to meet people. If you want to develop a friendship, if you're lonely, if you're single, like, this is a great way to meet people. And it's also going to save the fucking planet. So please join me and let's keep fighting for Bernie. So my state's going to vote in less than a week. We're going to have Super Tuesday. But we need to be working, even if your state's already voted, even after it votes, we need to keep working towards the general election. This has never been more important. So let's do this thing, fam. We need to fight for a world that cares more about human lives than profit. And only one of the 3 people that could be president come 2021 cares about human lives over profit, and that's Bernie Sanders. Thanks, fam.